Hello, everyone. Welcome to another episode of Dr. Tashambi Speaks. I am Dr. Tashambi. Today, I want to talk to you all about the importance of malpractice insurance. So now it's like we're kind of shifting to like the business side of nursing. You are your own individual brand and your own individual entrepreneur. So think about health malpractice insurance the way we think about car insurance. We buy it, we're mandated to have it. The only difference with nurses is that we're not mandated to have it on our own. We just have to be savvy enough to know that we need it. So think about it like you think about your car insurance. It's something that you have. You hope you never have to use it, but I bet you if you have to use it, aren't you glad that you have it? So it's kind of like that. You want to make sure you have something that protects you. And the reason why you want to have it is because when we step into the clinical environment, we are at risk. It's just like when we drive. When we get on that freeway and we're driving 70, 75 miles per hour. I'm not going to talk about the people that do 85 and 90. But you want to make sure that you're safe and you're covered if you have an accident. So when you step into the clinical environment, you are at risk. Think about it. We are going into a live clinical environment with humans. Some of us, we get report from people and maybe they were short the shift before we came in. And something that occurs when the shift is short is people begin to do what is known as rationing the healthcare. So what does rationing healthcare looks like? Rationing healthcare means I'm on this midnight shift, and I'm not picking on the midnight nurses, but y'all know they let us work short. So say you come in on day shift and the midnight nurse was short on nights, and maybe they had 8 patients, maybe they had 3 on their own, and they had 5 with help, meaning when I say help, we're talking about a nurse assistant or a tech was with them. So sometimes when you're working short like that, that nurse is at risk, and they begin to do what's called rationing the healthcare, meaning I'm gonna spread myself out among a lot of people, and I need to do a lot of different things, and I can only do a little bit for each individual person. So when you come in on day shift, you are at risk of finding a lot of things that may not have gotten done. And so if you're not on top of it the way you need to be on top of it, or the way maybe you can be on top of it, because sometimes the assignments are so heavy until it's almost impossible. But nevertheless, once that nurse gives us report, handover report, handoff report, legally according to the state of Michigan, we are responsible for that care assignment. So when we do things like give medications, just think if you had 5 patients and each one of those patients got 5 medications and you had to give them those meds twice a day, right? So now you're giving 5 people 50 different pills. Think about that. That is a risk. So you run the risk of giving them too much medication, not enough medication. Maybe you have a person who's scheduled for a test. They were supposed to be kept NPO. We didn't keep them NPO. The test ended up getting canceled. God forbid they go downstairs and they get intubated and they realize the person wasn't kept NPO. All of these things are risk. I read an article one time. It said that in a 12-hour shift, nurses do over 400 tasks per shift. So everything that we do, we increase the risk of making an error. It could be something like putting in a Foley catheter. It could be suctioning a trach, hooking up a tube feeding to a patient. All of those things, every single encounter, getting the patient up from the bed to the chair. Maybe their knees get weak, they fall, they fracture their hip. There are so many things that we can do in an 8 or 12-hour shift that puts us at risk. So what we need to know is that you have to cover yourself if we do have a bad outcome. And I think sometimes people don't think of it on this level. This is more on a managerial level. If a person becomes injured, one of the things we have to do is an investigation. So during an investigation, there are a lot of moving parts that occur. First of all, we might do something that's called sequester all equipment. Maybe a person had a PCA pump and maybe the pump was programmed improperly and the person was overdosed and they, had to go to the unit because their pulse ox dropped and they went into respiratory distress, they are going to sequester that PCA pump. They don't want anyone going in there trying to change settings or anything like that, because if the person does not make it, Joint Commission requires us to do a Joint Commission framework, which is a long process. It's a form that when you get done filling this form out as a manager, it probably would take up to about maybe 20 pages typed when you fill this document out. And one of the things it's going to ask is, was there equipment involved, and was the equipment interrogated by biomed? So that's one thing, one aspect, sequestering equipment. They can get, maybe a person falls. They want to say, okay, who was the last person in the room? Let's look at the rounding log. Let's look in the computer to see when was the last time a round was done. Was the bed alarm on? Did the person have signage? And when we say signage, fall alert, bracelets, yellow socks. All of these things have to be attended to and investigated to see what is the source, or what was the source for the person having a negative outcome. So those are a couple of things that we do. Something else that we do is we want to make sure the nurse was properly trained. They'll go back in, if it's equipment, they'll go back in and look at your, your net learnings or your health streams to make sure you were properly trained, because they're trying to find out what caused that outcome to occur. If the person expires and maybe the nurse ends up getting terminated at the end of the investigation, they have to turn that nurse in to the state of Michigan, because technically that is considered conduct detrimental to the well-being of the patient. So this is where you have on our Michigan website, if you go in on disciplinary action report, I looked on it today, there are people who are on there for failure to demonstrate good moral character, negligence. We don't know what that negligence involves, but a patient actually expiring, that could fall under negligence. So by law, your job would have to report that firing to the State Board of Nursing. So the takeaway is that you want to make sure that you have your own individual insurance, because if they determine that the error occurred and it was the nurse's fault, guess what? The hospital insurance, it doesn't cover you. It does not cover you, because what they'll say is you breached their policy, you breached their practices, and as a result, their coverage doesn't cover you, because if you think about it, they're trying to look out for themselves. So what I'm making this video for is because I want you to realize you have to look out for yourself. There is insurance out there. To be honest with you, as long as I practiced nursing, I never got malpractice insurance until 2014. 2014. I've been a nurse for over 30 years. I never got malpractice insurance until 2014. A place where I worked, they wanted me to get my own insurance. So, and it's amazing because I have insurance. It's called NSO. I'm not getting a check from them, you all. I'm just telling you what I have. It's economical. I pay $106 a year for it. It's worth it, because if something happens, you don't want to have to go through your hospital or your organization's lawyers to be able to talk to someone about your case. You want to be able to call someone, and you want them to call you by your first and last name and talk to you about what's going on as far as your financial future and your licensure. Okay. So, and what I like about this company is on the front, their logo, they talk about how the hospital's insurance is to cover them and your insurance is for you to be covered. And it's true. So I just want you all to make sure that while you're practicing, that you have everything, as they say, all your ducks in a row. We want to make sure that you're covered. So if something happens, you have something to fall back on, and you have someone who's going to advocate for you, because over the years I've learned it does not take a lot for a negative outcome to occur, especially when we are short-staffed, when we have problems with equipment. And a lot of times people don't want to hear that aspect of it, but I've been a nurse long enough and I've practiced long enough to know that sometimes there are things that happen outside of our control, and when it does happen, you want someone that's going to advocate for you. All right? Thank you. If you all have questions, feel free to email me And my email address is drtashambispeaks@gmail.com. And follow me on Instagram at Dr. Tashambi Speaks. Thank you.